Thank you for joining us for Talking Sleep, a podcast of the American Academy of Sleep Medicine. I'm your host, Dr. Seema Khosla, Medical Director of the North Dakota Center for Sleep in Fargo. Today's episode is brought to you by Apria. AI is popping up everywhere. When we open a PDF, use an AI scribe, or look something up with ChatGPT, the results can be fun and often helpful to take care of repetitive tasks. AI has evolved rapidly and isn't a monolith. There is generative AI like ChatGPT, analytical AI, and large language models. There are deep neural networks that can analyze vast amounts of data to find patterns which may help us to predict disease or outcomes. We all interface with AI daily and may not even realize it. This can become very complex and somewhat mysterious. How can we use AI in a sleep medicine practice? Is it trustworthy? The AASM has an AI committee tasked with these questions. This committee recently released a SWOT analysis on the use of AI-enabled technology in sleep medicine. Dr. Margarita Oks is chair of the AASM AI Committee. She serves as the program director of the Pulmonary Critical Care Fellowship and is associate program director of the Sleep Medicine Fellowship at Lenox Hill Hospital. Matt Anastasi is Sleep Team Resources Manager at the AASM, which includes roles as staff liaison for the AI and Sleep Medicine Committee, product owner for the Auto Scoring Certification Program, and project manager for the Sleep ISR Interscore Reliability Program. They are here to discuss their analysis of the use of AI in sleep medicine. Thanks for joining us today. Welcome.
Thanks
for having us.
So I wonder if we can level set here. So when we refer to AI, what are we talking about? Is AI what we think it is?
Well, AI is really any method that allows a computer system to perform human tasks that require intelligence and logic. So this includes speech recognition, decision making, and visual recognition of patterns and objects. So in that respect, with that definition, it's been around a while, since the very first computer was created and before most of us were even around. So yeah, it's no surprise that AI it's best suited to support repetitive tasks.
So are there different subtypes of AI?
Yeah, absolutely. There's machine learning ushered in the first algorithms that rely on statistical methods to learn from data in order to make predictions about the output. So machine learning gave computers the ability to learn without being explicitly programmed. So if you feed the algorithm with enough data of good quality, machine learning allows that algorithm to create strategies for excelling at that particular task. Yeah. So the most recent variant of AI is called deep learning. So that's a set of advanced computing techniques designed to more closely resemble the decision-making of the human brain in order to not simply follow tasks or even learn them in a limited way, but instead where the algorithms themselves are able to learn about important features about the data and come up with new predictions and new algorithms, again, without intervention from a programmer.
So let's talk about your paper. You guys came up with this SWOT analysis of AI. So tell me about it.
So, over the past couple of years at the AASM AI Committee, we have really struggled in identifying an appropriate guidance for our community in sleep medicine. How can we navigate the mysterious, as you called it, world of AI? And in order to do that effectively, I think we have to be able to understand the strengths, the weaknesses, the opportunities, and the threats that come with AI, because it is, almost like a black hole in some respects. So this is kind of how the thought process came about to do a SWOT analysis of AI in sleep medicine. And we primarily focused on three areas within sleep medicine, and that's clinical care, lifestyle management, and population health management, which are really the three areas that I think are the most impactful on the clinical side as well as the research side.
Okay, so let's start with the clinical stuff. Like, how are we going to interface with AI in the clinical part of sleep medicine?
Yeah. So that's really where I think the most familiarity exists with AI in sleep medicine. And, there are different subsets of this, right? So you have diagnostic tools that AI is, being employed in. Also, AI is being used in addressing personalized treatment plans and also just for follow-up on the patient care side. And each of those, different subsets have particular advances. Some of them are more mainstream than others. For example, PSG scoring, that's something that most of us have probably have heard a lot about and have familiarity with. But there are other less commonly known, but just as, progressive thoughts and research ideas that are really becoming more mainstream only on a monthly basis.
That's, I feel like, the way that most of us have sort of dipped our toes in the water of AI is scoring.
Right.
So is that something then you would categorize as a strength?
Absolutely. I think, the scoring, the polysomnography, I think that's kind of the perfect tool that we have that is, a perfect marriage with AI, right? Because it's just, we already have automated sleep systems for this and scoring software. So now to mine that data is very helpful, right? So that's number one. But AI is outside of sleep stages. We're now trying to figure out if we can do spindles, K complexes, arousals, things like that. Even look at EMG channels. There's even research in using AI to diagnose narcolepsy and REM behavior disorders. So there's, a huge pool of all of this that can be tapped into.
So you mentioned a couple of things, right? So the hypnodensity, is that what you're referring to with the narcolepsy? Yeah, Dr. Mignot's work.
Yes,
Yeah.
yes.
And then so the other one that got my attention is something I've I've been asking for many years, is the RBD
Yes.
one. Because sometimes I think it's hard. You look at it and you're like, okay, I go back and I compare it to, stage N2, and and sometimes it's hard to tell. Is it up? Is it down? Is it up enough?
Correct. And, there's also a lot of just artifacts, right, that we see. And,
Right.
as much as we try when our scorers and ourselves, is on the clinical side reviewing the studies, it's very difficult because sometimes just patients are not necessarily the best, don't have the best channels that we can kind of see and make the appropriate diagnosis.
So what are some other strengths then of AI and other clinical applications that you hinted at?
So, from the follow-up perspective, I think the strength of AI is with that patient accountability and the patient physician or the patient clinician interaction, right? So, we can use AI to monitor CPAP adherence, which is a huge thing. Even for mask fittings, right, which has been the bane of our existence in the sleep medicine world, because it's just, that's one of the biggest failure points with adherence, right? So there's a lot of mask fitting AI apps and interfaces. And also, I think in terms of forward thinking, one of the best things is to be able to have a pathway to use AI to kind of phenotype some of the disease processes that we have in sleep medicine that we're currently mining PSG data for. But if AI can be helpful with this, I think it's going to move the field significantly forward.
So when you talk about phenotyping, is that limited to obstructive sleep apnea then?
No, I mean, I think, phenotyping exists, most likely exists in a lot of the sleep disorders that we see, and it's just not really identified. I mean, sleep medicine has come a long way, but we're still, struggling. We're struggling even with the basics of, the apnea-hypopnea index and what's the correct definition. So I think the sleep disordered breathing is the perfect kind of ripe disease with OSA as the forerunner. But I think that there's definitely other phenotypes that can be elucidated in things like, narcolepsy, idiopathic hypersomnolence, RBD. It just has to be found.
So you're reading the tea leaves.
Yes, so to speak, hopefully.
So this is the part that I kind of struggle with is how do I know if AI is going to work for my patient population, right? Like how do I know what that training data set was?
There's one thing to recognize is there likely is going to be bias
Mm,
in that data set. So despite the best efforts of the developers in creating a training data set that is completely representative of the end use, that the intended use for the
mm-hmm,
product, there's still going to be some uh, you know something that was missed.
mm-hmm.
So really, you just need to follow a few different guidelines. Um, you want to test the product against your own gold standard in the sleep center. So whether it's a human score in the
Mm.
case of polysomnography auto scoring or an RT performing a mass fitting, you really want to put those side by side and really find out is the solution solving a problem that we have, or is it really just another option?
Well, and I think that AI assisted mask fitting sort of, I felt like it had a role during COVID, especially.
Right,
So
right,
I thought that was kind of a cool real life, case use, I suppose, of that type of AI. But I'm glad you brought up bias, right? Because
right.
one concern is this risk of amplifying bias. So over the summer at the sleep meeting, we were doing a session on legal issues with sleep medicine, and Kathy Goldstein quoted Nate Watson and Sam Rusk at this session, and she said that one clinician can harm a few, an algorithm can harm millions. So,
Mm.
how do we safeguard against this?
Well, we need really everyone to understand that machine learning is a product of the information it learns from.
Mm,
So if the data isn't representative of everyone, it will be biased in one way or another. So it is an uphill battle
mm,
to get the algorithm to have data representing everyone. And, how do you safeguard against that bias? You want to recognize that there likely is the bias
mm.
and review the results carefully using that lens. Seek to utilize the highly diverse and large data set and be transparent about the training data and the AI techniques used in the algorithm. And then make sure you set a high bar for what's acceptable and what isn't. So the ASM, in terms of auto scoring, we have an auto scoring certification program, and that's
Mm.
an example of how we can set and maintain a high bar that builds trust in the results of these solutions.
It's funny that you use the term auto scoring because I remember in fellowship that was always like, ooh, yeah, we don't trust the auto scoring
Yeah,
algorithm. But now it's
no,
it's come back, right?
yeah, it was looked down upon, but
Yeah.
within the past several years, there's really even before the products were available, there was research that wasn't at scale at that point
Mm,
that was showing the auto scoring could match or even exceed the accuracy of humans. And now we're starting to get to the point where we're actually putting the products side by side with experienced human scores, and we're able to demonstrate that they're reaching that bar. So that's the first example where the ASM has had that oversight.
mm,
We had a pilot for the auto scoring certification where we collected data. We had the data scored by manual scores,
mm.
and then we compared it to the algorithm's performance scoring that same exact data. And if they reach a certain threshold, then it gets certified. So we've had a few companies volunteer for this program. It's a voluntary program, and they have passed certification. So we're looking at expanding this to a full PSG. Right now, it's
Hmm.
just for staging, evaluating staging, but we're looking at expanding it to the full PSG.
So that's funny. In one section, you have kind of transitioned. You've changed a weakness into a strength. You've sort of
Hmm.
acknowledged this weakness
Right.
about potential bias, right? And then you've sort of delineated ways that we can protect against it. And then you've kind of turned it into this strength because now we have this certification program,
Hmm.
right?
Yeah.
So, what other weaknesses should we be thinking about?
Well, in terms of, I mean, there's a lot of forms of bias, but you know, we want to deploy any AI approach that we take ethically. So in the SWOT analysis that was released on July the 1st from the AI committee in the Journal of Clinical Sleep Medicine, we refer to a bunch of resources that you can use to deploy your technology ethically. So there's one by the AMA called the American Medical Association Principles for Augmented Intelligence Development, Deployment,
Mm,
and Use. I'd encourage members to review that. And what it does is it reviews approaches for AI tools that aren't yet regulated by policy, because there really is not that much out there regulating AI solutions. But the AMA states that medical specialty societies, clinical experts, and informaticists are best positions and should be able to identify the most appropriate uses of AI
mm.
technologies and set the standard of care. So, as long as the right people are evaluating the technology, that's really going to set us up for success.
And there's also, if I can just mention, a similar guidance from the National Institute of Standards and Technology. And they also provide some level of framework of how AI should be implemented on the medical side, so that it becomes more transparent, more usable, and mitigates some of the concerns that we have with privacy, bias, et cetera.
So if I think about this, right, we deploy AI and we inherently have to have trust in the algorithm, right?
Right.
So how do I know if the algorithm's right? It kind of reminds me. So when I was a fellow, they used to talk about, okay, there is, the story of, well, lung cancer risk is higher in people who carry lighters, right? And it doesn't mean the
Hmm.
lighter causes a cancer. There's like this other thing that hasn't been factored in. So how do we know if this algorithm is right?
Yeah. So when we're evaluating algorithms, uh, when when we're reading medical AI papers, reviewing products, reading news about advances in AI, the most important question to ask is really about the quality of the source of the data. So it really all comes back to that.
Mm,
So this is something we explain when talking about training sets, but no algorithm can be trained without a good amount of quality data. And the performance measured in precision and speed of the algorithm should be compared against previously existing solutions. And that's really what we're doing as part of this certification program.
mm.
And when you look at the latest pieces of news on smart algorithms, you should really watch out for the following, to be able to carefully assess the quality of the article. So if the term artificial intelligence is used, be be a little suspicious about that due to
Huh.
the overuse of the expression.
Okay.
The meaning has started to get inflated. So if a news announcement or a news article mentions AI without describing the exact method under it,
Mm.
it's a good sign to be skeptical and careful. But
Oh,
they should
that's
mention the
interesting.
yeah, so they should
Okay.
mention the subtype. Is it use machine learning, deep learning, and they should explain the method in detail to create the AI.
And
Mm,
also, I don't think that we should have a blind faith in the information that AI is giving us. I think we need to look at AI and the algorithms that are used the same way we look at journal articles, right? We're kind of taught
Hmm.
in medical school, et cetera, in professional schools to critically, dissect the introduction, the methods, the conclusions, the results, and then decide if it's good, valuable data that we can then apply to our own practices, et cetera, whatever. So I think, we really shouldn't be blindly trusting everything that's given to us. I think, and in fact, I think one of the best things that has happened in the last couple of years, the major companies that, have developed the generative AI models like ChatGPT, et cetera, they signed, a contract between themselves. It was voluntary, to ensure and essentially promise that they're going to be transparent in how they're generating the data sets, because, garbage in, garbage out.
Right. Yeah.
Right. And unfortunately, we have to be very cognizant of this, because on the medical side, this could be very damaging. Right. And in that case, Dr. Goldstein and Rusk are going to be completely correct. There could be some serious damage, right, on that side. So I think we have to be, very careful and be very critical of AI, and actually understand the data sets and the algorithms that are used to create whatever model is in question.
Okay, so you mentioned that, if the article talks just about AI in general, that we should be wary. So explain it to me like I'm 5. What are the different types of AI and what do they mean? So like generative AI, what does that mean?
Well, that's an algorithm that's been trained in language, and basically what it's doing is it's predicting the next word in a sentence, but it's doing it on a scale that it sounds good. So if it's creating the next word upon word and it comes up with a paragraph or an entire article, there's going to be gaps in there where it doesn't have the next word. So it's going to do the best it can to approximate or create that. So what that's called is confabulation. And that's, some people call it hallucinating. But there's been very high estimates on the amount of hallucinating that this Gen AI performs when it spits out an answer that it sounds confident is correct.
Azizi Satius made that point at Sleep Disruptors in the fall, right? That it's called hallucinations, but he thinks it's confabulation because you go from like a known point to the next known point, and how do you connect them?
Exactly.
So that's really interesting. I use this online platform for telemedicine, and they have a ChatGPT part of it, and they have like an AI scribe. And I've played around with the ChatGPT, and you can put in, generate a letter to United Healthcare, trying to get approved for like this drug for Xyrem. I think I did. And it was kind of cool how you watched it kind of create this letter, and it pulled in references, and I looked up the references and I'm like, yep, that's a real reference. And so it was interesting. I've tried 2 different AI scribes, and at first I was super excited. And then when I started seeing patients back in clinic, I was like, oh, these notes are really hard to read. I don't like this. And so I abandoned both of them. But what I'm kind of wondering then, so that's generative AI, right? But I also heard you talk about like these neural networks, and is that the same as analytical AI, or are those 2 separate things?
Analytical AI, I think of as more analyzing, kind of what I was saying in the beginning is patterns and objects. I'm not familiar with that one as much as deep learning though is really what it learns will actually change, has the capability of changing the algorithm itself. So it's completely devoid of any computer programming, annotating from humans, and you kind of set it and let it go. But it's a very complicated system.
Yeah. And, just to add to that, so, you can look at the neural network. So it's a form of machine learning, right? It's a process, and it's essentially designed in the hopes of replicating the way neurons make connections in our brain. So it's you allow the computer or teach the computer to recognize data, patterns, text, whatever. And then using that information, then you want to get to a prediction or an insight or like an answer or something like that you're looking for as your initial for your question. And there are different kind of ways that neural networks work, but I think that's kind of the underlying idea behind the process.
Are there other types of AI?
Well, I think one other thing to mention about the difference between like AI and machine learning and then getting to deep learning is cats and dogs. So with machine learning, if you give an algorithm and show an algorithm pictures of cats and pictures of dogs that are labeled cats and dogs, it will learn from what it sees, those attributes and qualities for each that make them different. But with deep learning, you're basically just giving them a whole bunch of images of dogs, and it needs to make it up itself and learn itself what are the attributes of a dog that make it different from cats. So they're not labeled, they're not set. It doesn't say, this is a cat tail or this is a dog tail, but it's unlabeled data that it learns from.
I think this is the point that makes people uncomfortable.
Mm-hmm. Yep.
So what can we do to understand this better? And maybe it's not even comfort. Maybe it's that we're intimidated. Like, how do we still get to be in the driver's seat with all of this?
Yeah, I think that's the biggest hindrance, I think, in advancing AI on the clinical side. And I think the problem comes with, what we hear kind of on the news media and all of the deep fakes and everything that you hear, the community is concerned about. But I think to limit or get rid of some of that fear or intimidation, it's actually knowledge. I think in this situation, knowledge is truly power. What Matt just mentioned, the biggest issue that actually people have with AI is the development of self-aware AI, right? Because up until this point, all AI we have cannot make a value-based judgment, right? So it can't look at a data set and use the information it has the same way that a human brain can value-base a judgment and make a judgment call, right? That's the human level intelligence. So we're not there yet, technically. Will we get there? I mean, it's a possibility, but that's the danger, right? That's like what you see in the movies,
right.
And of everybody kind of running wild and AI taking over. So I think we have to realize that there's a huge level of sensationalism that's actually,
a lot of hype.
Yeah, a lot of hype, 100%, because of the media. So I think education in this is very important. I think knowing what is actually out there and understanding the limitations, understanding, that AI can be a partner, not a replacement of everything in sleep medicine and other medical fields, right? I think that's the most important part to kind of make us feel more comfortable, right? And then that allows us to also be the driver, as you say, right? What's going to allow us to be in the driver's seat? It's understanding that we are the driver, right? Not AI. So right now we're kind of acting like the passengers and maybe the backseat drivers, but we're definitely, I think that understanding what AI is and just listening to podcasts like yours would be very helpful.
Yeah. I was just going to say that there's a difference between the capability, the potential, and the power of AI as it's marketed to us and the actual use cases of AI and how it will really best serve our patients.
So let's take a short break, and when we come back, we'll talk more about the use of artificial intelligence in a sleep medicine practice. You're listening to Talking Sleep from the American Academy of Sleep Medicine.
Dive deeper into the future of sleep apnea therapy with the Apria Sleep Care program. Once we receive the PAP referral, our team springs into action, offering patients a seamless transition into therapy. Patients start by selecting how they want to begin their sleep journey: in-person care, virtual care, or self-directed care. With ongoing therapy support, including coaching, digital resources, and video assistance, we're committed to ensuring every patient's success. We stay connected with our patients with live calls, texts, emails, and IVR, all designed to make adherence a breeze. And with our supply schedule program, replacements are delivered like clockwork. Experience the difference of an enhanced sleep therapy program with Apria Healthcare. Discover more about our innovative sleep program online today at apria.com.
Welcome back to Talking Sleep. We're talking with Dr. Oks and Matt Anastasi about the clinical use of AI in sleep medicine. So, you mentioned sort of human level intelligence and sort of that value. I remember hearing that they were trying to train AI on humor and trying to train it to understand sarcasm and what was comedy. And that seems like a very humanistic trait to me.
Yeah, and it's not going too well so far, from what I've heard. I've heard a
There you
few
go.
of those jokes.
So we've kind of hit on the strengths and weaknesses, and you've kind of hinted a little bit about the opportunities. But what are the other opportunities for AI?
So we have a few, definitely in lifestyle and population health, right? I think those are the two other big kind of areas in which AI can be helpful. So, from the population health perspective, it's, the awareness, the increased access that people who are temporarily and geographically removed from access to healthcare, right? Now, not everybody, I'm from the East Coast, not everybody can go to a doctor that's 2 minutes away on the train. So that's a huge strength and opportunity for AI. And also just the surveillance, right? Just, like we mentioned before, using CPAP and being able to monitor how a patient is doing without them having to come in and, alerting me when somebody is not doing well and they're non-invasive ventilator or something like that, right? That can maybe prevent a hospitalization.
So when you're talking about access, you're talking about remotely fed information? Like, how does AI improve access to care?
Yeah, I mean, that's one of them, right? So there's home monitoring, right? You can, there's some apps that allow you to, a patient to collaborate and, touch base with their physician, right? So that's one of the premier kind of things. Yeah.
Yeah, it leads to early alerting to any changes in the patient condition. So it's kind of a seamless connectivity between clinician and patient.
And that's sort of based on CPAP data, or are we kind of delving into wearables and that sort of information?
Yeah, I mean, some of this
Both.
is future case. I mean, not all of this has been scaled yet, and there's some barriers to overcome. So you mentioned consumer devices, wearables. We're still not at the point where there's a standardization of reports across all the devices. Every device has its own index.
Sleep score, yeah.
Yeah. So that's not been standardized. That needs to be the clinician education on how devices are used and integrating that is not there. And the personalized treatments is definitely an opportunity for those consumer devices. So having algorithms that instead of do the things that they're limited in, predicting failure or success in personalized approaches like hypoglossal nerve stimulation or identifying different OSA endotypes. We're just not there at a scalable point. There's definitely been some smaller studies that are referenced in the article that try to connect those dots, but but we're not there yet.
Well, that's what I wonder, right? That there was some data on could you identify people at risk of abandoning treatment for their sleep disordered breathing without having to wait for the 30-day download or wait for a phone call or something like that? Is there something you can identify?
Yeah, that I would call that. I would
Right.
put that in the current use case
Mm-hmm.
category, the predictive analysis for
Mm-hmm.
PAP adherence. Anything beyond that is kind of where we're at there
Mm-hmm.
now. But I think that's where we're at now is that's starting to be implemented more at scaled level.
So then when you talk about opportunities in lifestyle, do you mean lifestyle medicine or what do you mean by that?
That's a wearable technology,
Mm.
data-driven lifestyle, and this encourages patients to take an active role in managing their health. So there was an
Ah,
AASM survey reported that 68% of adults who've used a sleep tracker said they've changed their behavior based on what they've learned.
I saw that and that surprised me. That seems
Yeah,
really
that's a
high.
high.
Yeah. Because I remember overhearing somebody on a bus, they were sort of commiserating about their poor sleep. And they're like, well, I don't need a Fitbit to tell me I don't sleep good. I know I don't sleep well. And I'm like, there you have it, right? So
Yeah,
that really surprises me. Wow.
yeah, yeah. But the SWOT article also brings out s- the internal and the external factors that
Mm,
can either be capitalized or be risks. So a risk of that, though, having that information if you get a false positive, think of the resources that go into
mm-hmm.
that, the anxiety that goes into that, and also on the other side, a false negative. To
Mm-hmm.
someone, it would hinder someone from seeking clinical evaluation
For sure.
just from that presumptive diagnosis.
Absolutely. Yeah.
Yeah.
A lot of times, is that information clinically valuable, right? Is it going to make
Mm,
me change what I'm going to discuss with the patient?
Mm.
And does it cause more stress than benefit, right? Is it clinically useful? And I think the jury is still out on a lot of the wearables that we have.
So then what about threats? We've talked about data privacy. Are there other threats of AI?
yeah, there's yeah, it depends on what you're looking at. If you look at clinical, yeah, we mentioned false positives,
Mm-hmm.
patient acceptance and trust. So
Mm.
yeah, that's a big one. So there was as part of the FDA's virtual public workshop on transparency of AI machine learning enabled medical devices in 2021, they did a survey of 1,800 patients and caregivers,
Okay.
and there were some surprising results. Nearly 75% of patients had a somewhat or very favorable view of AI in their medical devices,
Huh.
which surprised me that that was so high. And the top concerns, though, the two top were dealt with data privacy
Mhm.
and whether their AI enabled device was accurate.
Yeah, that's fair. Yeah, I get that.
And I think another thing that is very important and that we have, in our research found over and over again in all of these facets, right, is the fact that are we using good data? Because if we
Mm.
are building data sets and are excluding certain populations and socioeconomic groups, right, then we're not really helping the population at large, right? We're just
Right.
helping the population that the data set is trained on.
Mm-hmm.
And so the inequities that exist can be substantially algorithm.
Amplified. Yeah.
Yeah,
Yeah.
and it's a
Hmm.
huge issue. And I think that's one of the biggest issues I think that we have. And it's a huge threat to using AI.
So how do we deploy AI ethically?
Um, So I think the number one thing is transparency, right? I
Mm.
think it's very important for all of these companies because, industry is driving this. And realistically speaking, health systems don't have the financial resources to spearhead this, right?
Mm-hmm.
So we have to rely on the industry to be as transparent as possible within what they're putting out and allowing us to then evaluate that data, just like we do, the research studies for a new drug that comes out, right? We also
Huh.
we also have to be very clear on the support systems that exist within health institutions that are using AI, just to ensure that there's, legal standards are met, because it's a huge issue for the community.
And also disclosure. So, if a patient receives a result or an interpretation, they're assuming, just because it's always been that way, that it's all generated by humans. But we're not at a point
Good point.
in a regulatory standpoint.
Huh.
But why not implement regulations or even some policies in your own? We had a webinar. The AI committee had a webinar recently with some legal experts in data privacy, and they recommended including in your disclosure that agreement with patients that uh, you know AI would be used in the analysis of data or in the interpretation or in the diagnosis.
Which
So
gets
definitely,
back,
yeah,
but that gets back to your point earlier about transparency then.
right,
Yep,
right.
absolutely.
If we want to deploy AI in our practices, what does it take? Like, do you need a big IT department? What does that, or do we rely on industry? What does that look like?
Right. So I think, the practice that's interested, right? I think there has to be a systematic approach. And I think the first step should be to figure out exactly what they want AI to be used for. Is it clinical practice? Do they need it for scoring, for example? Do they want it for patient follow-up? Do they just want it for patient access, right? Because I think saying I want to implement AI, I mean, that's like saying, I love fruits, right? It doesn't get you anywhere, right? So I think you have to have a very clear goal as to what form of AI and how you want to use it. Then I think you need to have health system involvement, right? And that's where IT comes in, legal, the infrastructure, right? Do you have the support for clinicians who are then now going to start using this AI, don't know how to use the AI, and things come up, and with that there has to be financial resources, right? And with all of the the health system hacking that's occurring, you have to have very secure systems in place to ensure that there's no data leak and nothing can get into the wrong hands. And so it's almost as if, the health system itself, I think it's very difficult to do this on an individual practice outside of like using scribes and things like that, which can be single use, right? But on a health system level, I think there has to be the foresight of that health system to actually develop AI infrastructure. Because, then can you get the AI to integrate with your EMR? Right. Can you, things like that I think just on the implementation, because the AI can be there, but the actual practical getting it to the clinicians and then getting it to the patients, that's a completely different ballgame.
Yeah, it's we also mentioned a couple details in the challenges section on educating users on how to maintain privacy in an era of cloud-based systems, investing in secure access portals, and again, having that dedicated IT team providing logistical support. It is an investment.
So how do you even know what AI exists for what specific component, and can we influence which AI should exist? I'm hearing you say, well, you can't just say you want AI. You need to know, I want AI for this purpose. But how do I even know if that exists? And if it doesn't exist, how do I kind of encourage someone to make it exist? Right.
So, I mean, I think the first part of your question is an easier answer, right? I mean, I think that's being part of the community, such as AASM, right? Within our community, we have the AI committee, we have the technology committee. There are a lot of Massachusetts General, they have, a significant amount of AI output in terms of literature and kind of what's out there. So the information is there if you search for it, and you have to be critically evaluating that information, right? In terms of how do we influence what should exist. So that's difficult, right? I think the creation of AI is really driven a lot of times by the scientific community. And, a lot of times the scientific community moves at a much faster pace than the clinical and the practical implementation of that technology. So I think the collaboration between the clinical and the research side has to be a lot closer than it is, even though we are different, but we kind of have the same goal, right? So that is, it's the interactions with all of these companies that have the resources, because even if, one of us has a great idea for AI, it's not something that we necessarily have the resources to even implement or, produce or test, right? So you have to have some communication with industry and with the research community to kind of say, hey, I have this idea and I want to see if we can figure this out. And that has been done.
Yeah, have that communication open, just the way we do. Like just in developing that auto scoring certification, we took a lot of input from science, from clinician, from industry, just to develop something that would ultimately provide oversight. The same way you would, construct, an evaluation in your lab. You would take resources from all three areas.
Yep.
So we had one of our colleagues email us and ask if we could provide a summary of what we have discussed. And I've been really kind of thinking about how to do this. So I'm going to ask you guys, we're going to experiment. Can you give me, 2 or 3 takeaways, brief takeaways from our conversation today?
AI it's in its infancy, and that is overstated, but it's true with AI. We don't know where it will be 5 years from now. We do know it's here. We do know it's going to disrupt everything that we do, but we don't know how. But we do know that we're going to need to remain competitive. We'll need to change how we do our currently practice, and we need to learn about AI as much as we can, so that we're informed. We're asking informed questions about it. And the AI committee we have a committee webpage that will link with this interview, and it has webinars, it has position statements. We're actually coming out with an interactive education module, towards the fourth quarter of this year, that will cover everything that we talked about. And but really, I think the best advice is just take all the information that's already out there and just be open to it and not be fearful. Because there's been a lot of changes, technological changes over the years. I've been in sleep 25 years and have been through each of those changes and have adapted what I do and have thrived and progressed throughout my career. But I think someone who's newer in the career, or maybe hasn't weathered some of these changes, wouldn't have that same optimism. But I would say just to be reassuring that it's we'll weather this one as well.
And just to piggyback on that, I think the most important point, because, there's a lot of challenges, right? As we've heard throughout the hour. So I think if we all start looking at AI as an ally, as a partner, rather than an adversarial, opponent, I think our road in all of this is going to be a little bit easier. And I think there's going to be a lot just more collaboration and the ability to actually have AI really be helpful.
Well, thank you both for joining us today and for helping us maybe demystify AI. It can be confusing and overwhelming. So I do really appreciate you guys taking us through what really is a logical assessment of how we may want to consider deploying AI in our practices.
Our pleasure.
Thank you for having us.
Thanks for listening to Talking Sleep, brought to you by the American Academy of Sleep Medicine. For more podcast episodes, please visit our website at aasm.org. You can also subscribe through your favorite podcast service. And if you enjoyed this episode, please take a moment to leave a rating or review. For more feedback or suggestions, email us at podcast@aasm.org. I hope you'll join us again for more Talking Sleep. Until next time, this is Seema Khosla, encouraging you to sleep well so you can live well.